I'm Dr. Vidya Suratkal, cardiologist attached to the Lilavati Hospital. I take care of the non-invasive lab. We have the state-of-art Cardiology Non-Invasive Lab, which boasts of almost every possible non-invasive test which we could do and helps the patient in detection, in prognosis, in follow-up and treatment with all our tests. Now, what is echocardiography? It is, in simple words, sonography of the heart. Now, we have a variety of echocardiography which we offer to the patients, like 2D echo, 3D echo, 4D echo, transesophageal echo, dobutamine stress echo. Now, when do you do an echocardiography? What information does echo give you? It tells you if there are any structural problems with the heart, like a hole in the heart or a valve which is tight or loose or leaking, about the pumping of the heart, whether any damage has happened to the heart after a heart attack, whether there's fluid around the heart. Not only do we offer echocardiography to OPD patients, to health check patients, and to the indoor patients, but we also do bedside echocardiography, what we call portable, in the ICU, in the casualty, in the cath lab, in the OT. Now, what is special about 3D and 4D echo? This is a specialized or a super specialized test where only trained personnel work, where again, in patients who have to undergo surgery for valve replacements, post-valve, to see the functioning of the valves, to see whether they have any infection on the valve, to see the functioning of the valves for heart failure patients, and for certain other very, very specialized cases, we perform 3D and 4D echoes. Very few hospitals offer this test. We also have what is known as a transesophageal echocardiography test. This is like an endoscopy where in an awake patient, we pass the tube down the esophagus or the food pipe into the stomach and look at the heart from there. Now, this is especially useful when we suspect infections on the valves, when there are clots in the heart, or when there are some valve dysfunction and you want to know whether the valve is functioning well. Now, we also have a very new machine, in fact the latest in the market, extremely advanced, where this transesophageal echocardiography is done by 3D and 4D methods. Where do we use this? This is used often in the cath lab when we do the new procedures like what we call TAVR and mitra clip, that is valve replacements non-invasively without taking the patient to the OT. We also use the transesophageal echocardiography in our cardiac OTs when valve replacements are done to check whether the valve is functioning well or not after the surgery. Thanks.